Analysis now of the various COVID developments we've seen today. Joining me live is Dr Omar Khorshid, the President of the Australian Medical Association. Doctor, appreciate your time. Firstly, on the worst hit state of New South Wales, how confident are you that the New South Wales health system can expand its intensive care capacity if cases do continue to climb through October as expected? And what do you see that meaning for patients in terms of their care?
G'day, Ash. Look, the situation in New South Wales is very concerning, and it's not so much the ICU beds or the number of ventilators, which have, of course, been planned for many months now, but it's the staff to run them that's been the most critical issue. Furloughing staff that have been exposed to COVID limits those numbers, and, of course, with hundreds of extra people in hospital, including in ICU, that puts a strain on any health system. Now, I think we can be reasonably confident that there will be ICU beds of one sort or another with staff for everybody who needs them. But as we get more and more into the pandemic, as the numbers go up and up, the level of training of those staff will decrease. The staff will be more and more tired and exhausted. And I think we can be confident that the quality of care that you can expect to receive will be under pressure. That's why it's critical that New South Wales doesn't take steps to open up right at the time when ICU admissions and hospital admissions are at their peak, if that is in October.
I know that you've been calling for mandatory vaccinations for the healthcare sector. That's an idea that was put to the Prime Minister, Scott Morrison, in his news conference earlier this hour, and one that he certainly seemed to be supporting, pointing out that this is a matter for the states. You're looking at, when you talk about the entire healthcare system, I understand that you're including support staff. So we're talking cleaners, we're talking receptionists, contractors who go in and out of hospitals. By when would you like to see that happen? And are you hopeful that it actually will? Because as we know, there's been a real delay on this movement for mandatory jabs for the disability care sector, for example. That's something that's been called for months now, but we haven't seen any action on that front.
Yeah, governments are reluctant to mandate anything in the community, and we understand that. But in healthcare, we are right on the front line, and every worker who attends a hospital or a healthcare facility, and most importantly, any patient that turns up to those facilities have an expectation that they'll be safe. And the only way to really ensure safety is to make sure that all of our healthcare workers are vaccinated, and that includes other people who are entering hospital facilities, including clerical workers, cleaners, and so on. So we think that's a very reasonable call to be making. And the reason we're making it nationally is because we do want our National Cabinet to show some leadership here and to encourage every state and territory to put in place the public health orders, because that's how this can happen. It's actually really hard for an employer off their own bat to mandate vaccination, especially a small employer. But with a public health order, as we've seen in New South Wales, it can be done with the stroke of a pen and the issuing of a statement. And it just needs to be within a reasonable time frame so that there's plenty of access to vaccines and so that we can enter next year or the potential opening up time with the knowledge that our healthcare workforce are fully protected.
Should that plan for mandatory jabs be extended to the school system? Would you like to see all school teachers being told that they need to get the jab?
I think school teachers are really keen to get the jab, and I think they've been upset that they haven't been prioritised so far. And particularly if we haven't fully vaccinated our children yet, by the time we start opening up, then teachers are actually going to be very vulnerable in school. So they're a group that certainly should get access to vaccines as a priority. But there's probably not a lot of point in mandating it until we're in a situation where we can actually protect the children themselves with vaccines as well.